Worried about this new patient, Maria. She's 80 years old and has just arrived in the department complaining of feeling sick and weak. I haven't had a chance to find out any more information, but I think she needs a review. Can you come and see her, please?
Hi there, Maria. I'm your healthcare provider for today. Pleased to meet you.
Hi, it's good to meet you, and thanks for coming to see me so quickly. I feel dreadful.
Before I ask you anything more, can you confirm your name, age, and date of birth?
Sure, it's Maria Perez. I was born October 13th, and I'm 80 years old. Although today I feel about 100.
Can you tell me about what's brought you in today?
I've just been feeling so sick over the last few days. I can't keep anything down. My heart also feels like it's racing today. That's why I thought I'd better come to the hospital.
Can you tell me when this all started?
Yes, it started 2 days ago. I was at my daughter's over the weekend. We were having a big barbecue to celebrate her birthday. But I think I ate something that didn't agree with me, because since then I've just been so sick. And I've had bad diarrhea too. It's been awful.
And have you noticed any other symptoms at all? Have you been hot and sweaty or had blood in the diarrhea?
No blood in the stool. I've just felt terribly unwell, and I've not been keeping much down at all.
Are you in any pain at the moment?
I've had terrible stomach cramps right before I have to run to the toilet to move my bowels. There's a real urgency there at the moment.
And aside from the issues you've mentioned, do you have any other medical problems?
So I have high blood pressure, heart problems, and I had breast cancer. I also have arthritis.
Okay, and what heart problems exactly do you have? And are you having treatment for your breast cancer?
I had a heart attack a few years ago, and recently I've been told I have heart failure, but my doctor said it's stable. In terms of the cancer, I couldn't have an operation due to my other medical problems, so I'm on a hormone tablet. My doctor also tells me my kidneys aren't what they used to be.
Have you had any previous surgeries or general anesthetics?
Nope.
Can you tell me what medications you're taking, please?
Oh, there are quite a few. It may be easier to tell you what I don't take. Let's see. There's Ramipril, bisoprolol, acetaminophen, aspirin, a statin, a water tablet. I also have a spray for under my tongue if I get chest pain. And I take a hormone tablet for the breast cancer. Gosh, it sounds so busy here today. I hope I'm not wasting your time. You must have lots of other patients to see.
And are you taking any non-prescription medications?
No.
Are you allergic to anything?
Oh, yes, a few. Penicillin, it gives me an upset stomach. And codeine makes me feel sick.
Have you had any pain or other problems in your chest?
No pain. It just feels like my heart is racing today.
And do you get more breathless on lying flat? Or have you noticed any swelling of your legs recently?
I can't lie flat for long. I sleep with 3 pillows, but that's been the same for years. I do get ankle swelling, which at times is worse than others, but my doctor tells me it's just fluid and I should be keeping my legs up on my stool when I sit.
Have you had any breathing problems?
Nope.
You've mentioned some vomiting. Have you had any difficulty swallowing, heartburn, or stomach pain?
Yes, the vomiting. Terrible. A bit of cramping in my stomach too, with the awful diarrhea. But none of those other things, I don't think.
And is there any blood in your stool at the moment?
No, Nothing like that at all.
Are you having any issues passing urine?
No difficulty when I pee, but I haven't been peeing much. You see, I just can't keep any fluids down.
Any rashes or lumps and bumps you've noticed?
No,
Any issues with your ears, your nose, or your throat?
no.
I don't think you've requested any monitoring for this chart yet. The EKG is done. I left it on the desk. Glucose is 99 milligrams per deciliter, in normal range.
We're going to insert a catheter for you now, if that's okay.
Sure, if you feel it's needed.
That's the catheter in place. That's the urine dip done. I've input the results onto the computer. I've started measuring your fluid input and output hourly. That way I can assure the electronic chart on the computer is updated.
Excuse me, can you tell me what you think is going on with me? I'm a little confused as to what's going on.
Blood pressure has been taken, but you can recheck the patient's blood pressure at any time using the monitor.
Capillary refill time is 4 seconds.
I'm sorry I don't have the monitoring equipment right now, but I'll get someone to look for it.
Would I be able to get something for this sickness, please? I feel so nauseous.
You can record your vitals on the early warning system chart on the computer at any time. Those fluids are up and running. I'll let you know when the bag's finished.
Can you tell me what's going on? Do you think I'll need to stay in the hospital?
Right, that's all of the vital signs documented on the computer. Respiratory rate is normal at 18 breaths per minute. I'd like to listen to your abdomen with my stethoscope, and we'll need to lower your gown a bit.
Sure, that's fine.
Abdomen symmetrical in color and shape. Audible bowel sounds in all 4 quadrants.
Oh my God.
Abdomen soft, some generalized discomfort on palpation, no masses, no organomegaly.
That bag of fluid has finished.
I'd like to bring your gown down to check your skin. Is that okay?
Sure, that's fine.
On completion of a full skin examination, there is decreased skin turgor noted, but no abnormalities found.
You can view the completed skin assessment chart on the computer.
Dry mucous membranes, no mucositis. I'd like to bring your gown down to check your skin. Is that okay?
Sure, that's fine.
On completion of a full skin examination, there is decreased skin turgor noted, but no abnormalities found.
You can view the completed skin assessment chart on the computer.
Okay, so this background you've given me is concerning, and the EKG shows some characteristic changes. Some lab tests would help paint a clearer picture of what's going on with this lady. Can you get these, please, and call me back? Okay, you're doing well getting Maria's treatment started for her acute kidney injury and hyperkalemia. Remember to take another EKG if you have not done so. It may be too early to see any improvement, but we want to monitor her during her treatment. Continue to monitor her vital signs as well. Please call me back and let me know before you move on to your next patient.
Glucose is 99 milligrams per deciliter in normal range. Blood ketones are 0.5 millimoles per liter. That's normal.
Okay, you're doing well getting Maria's treatment started for her acute kidney injury and hyperkalemia. Remember to take another EKG if you have not done so. It may be too early to see any improvement, but we want to monitor her during her treatment. Continue to monitor her vital signs as well. Please call me back and let me know before you move on to your next patient.
The EKG is done. I left it on the desk.
Okay, that medication's given. Okay, that medication's given. Okay, that medication's given. Let me update you on where we are clinically at the moment.
Okay, thanks for updating me on the situation and progress.
By looks of your patient's response to her meds, she appears to be stable for the moment. You may move on to your next patient, and I'll be down shortly.
Let me update you on what's going on at the moment. How are you feeling now, Maria?
A bit better, thanks. Thanks for that update.